prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how he or she can participate. Listen to any suggestion made by the client or support people. So, good evening, sir. My name is Gaston R. Hirona. I am your student nurse for today. I am from Central Mindanao University. So, pwede ko makabalos yung full name, sir?
I'm Ricardo Jose B. Dugas.
Kasi mo birthday, sir?
March 25, 2003.
Pwede i-check ako, sir. So, what is that? Okay. This is to ensure that the right patient receives the right intervention and avoids error. So sir, kung button crown, sir, is to assist you in turning up into the bed. Would that be okay, sir?
Yes, it's okay.
Then perform hand hygiene and observe other appropriate infection prevention procedures. This is to avoid the spread of microorganisms and for the safety of the patient. Then provide for client privacy. You can do this by closing the curtains or closing the doors. This is to alleviate the anxiety that the patient might feel. Since the doors are already closed and the curtains are also closed, we can proceed to the next step, which is to adjust the head of the bed to a flat position or as low as the client can tolerate. Then raise the bed to a height appropriate for personal safety. Lock the wheels on the bed and raise the rail on the side of the bed opposite to you. Then remove all pillows, then place one against the head of the bed. The client who is able to reposition without any assistance, place the bed in a flat or reverse Trendelenburg's position, as tolerated by the client. Then stand by and instruct the client to move self. Assess if the client is able to move without causing friction to the skin. Encourage the client to reach up and grasp the upper side rails with both hands and knees, and push off with the feet and pull up with the arms simultaneously. But for the client who is partially able to assist, for a client who weighs less than 200 pounds, use a friction reducing device, and 2 assistants for a client who weighs between 201 and 300 pounds. Use a friction reducing slide sheet and 4 assistants, or an air transfer system and 2 assistants. For a client who weighs more than 300 pounds, use an air transfer system and 2 assistants, or a total transfer lift. So, tanga ako friction reducing device, sir, para di ra kayo siya. There, sir, pag-turn ko dito aside. Then pag-turn ko, sir. Then pag-turn ko dito aside. Then, sir. Then we're going to ask the client to flex the hips and knees and position the feet so that they can be used effectively for pushing. So pwede na ako i-pan mo ni sir. Flex. Sir, very good, sir. Then place the client's arm across the chest. Ask the client to flex the neck during the move and keep the head off the bed surface. So, waton, sir, kay kanamor siya wakanda, sir. Then kamulog pag-move, sir, imong neck imong i-flex gyapon, then imong bed kay imong head is ayo siya ikuan sa surface, sir. Ayo siya itamak sa surface or butang na riyo, sir. Then use the friction reducing device and assistance to move the client up in bed. Ask the client to push on the count of 3. So we are going to position ourselves appropriately and move the client by face the direction of the movement, and then assume a broad stance with the foot nearest the bed behind the forward foot and weight on the forward foot. Lean your trunk forward from the hips, flex the hips, knees, and ankles. Tighten your gluteal, abdominal, leg, and arm muscles and rock from the back to the leg, front leg, and back again. Then shift your weight to the front leg as the client pushes with the heels so that the client moves toward the head of the bed. So, as the instructions ganyan sir, mong liog sir, ipathangad. Then, pag push na yun sir, on the count of 3. 1, 2, 3. Very good sir. Then we are going to ensure the client comfort, elevate the head of the bed, and provide appropriate support devices for the client's new position. After that procedure, we are going to document all relevant information. We're going to record the time and change the position move from and position move to, any sign of pressure areas, use of support devices, the ability of client to assist in moving and turning, response of client to moving and turning, and we are going to record this information for future references for the client and to improve the care. So that will be all. Thank you.